I've been doing, well, I did your protocol with all your free stuff for maybe around 6 months, around 1.5 and 2 pounds of the greens and half to 1 cup of the omegas. And I started having some problems. I had like incontinence, and I had like the liver enzymes were elevated. What else? The
What are you doing it for?
I have Hashimotos and Sjogren's.
Okay.
And the estradiol was also like low.
Mhm.
So I went to the doctors and they said like it was too much fiber. So I'm back to whole food, plant-based. I'm still trying to do um, the salads and some omegas, but I don't know if you have any recommendation for me. I started
You say you were doing a
eating cooked
full,
foods.
did you say you're doing a full cup of flax tortilla?
Yeah, that was the highest I did. Yeah,
Yeah. And you had incontinence, what, of stool or of urine?
but both.
Okay. So it sounds like you might have been overdoing it a bit there. I mean, I can tell you for sure that eating this way is going to bring down things like liver enzymes, and we've helped people optimize hormonal health. So I don't know if that was something that was just not tested before, or if because sometimes people will get a result, but their last test was 6 months or something before. So they don't know, like the data points don't match, you know what I mean? Versus if you had it like every week or every month. But if you were having trouble getting it all in, one, go back to more the minimal side. I mean, I don't eat a cup of seeds a day. If you're constipated, use something like the cold pressed flaxseed oil. If you're having diarrhea, stick with the seeds. But it sounds like that might have been the issue. The other stuff, I don't think that's really connected. In fact, if I would recommend you do it to reverse the Hashimotos. So go back to doing it in a way that you feel is more manageable, right? And work your way back up to it again. But you're not going to reverse the Hashimotos doing it the way you are now. You want to bring those foods back. And if you don't like smoothies, you can always do it in salads. And if you're really struggling, listen, I try to teach it all for free. I spend a lot of time online teaching for free, like I am right now, but some people need help. And that's why the rest of the time that I'm not teaching, I'm seeing clients either in wellness consultations or in rapid recovery. So if you're struggling to do it on your own and you need help to get it right, that would be when you make an appointment with me or work with me so I can solve the problems, because it's hard for me to know. Like, I hear a story, but I don't really know everything you were eating on each day and all the other things going on in your life. So I don't really have any other answers for you besides, yes, this works to reverse the conditions you have, and we have to just get it right and work with your gut issues.
Again, thank you so much for that.
Yeah, I wish I could help more, but that's, it's kind of a black hole. I don't know what happened.
Yeah, amazing though, everything you're sharing. Let's go over now to Lisa B. Hi, Lisa. Oh, Lisa, I'm going to unmute you. Okay, hang on. Hi, Lisa.
Lisa.
Hi, thank you. I'm assuming you can hear me.
Yep.
You can hear me? Okay.
Yep, we can hear you just fine.
Thank you. So I was following you on your Facebook page for a while, and what kind of grabbed me was because I have myasthenia gravis and I'm having an anxiety issue, is that you had made a post that I think it was a neuromuscular, and it was in your stomach. I forgot exactly the terminology to use, but I was like, okay. And then that's when I really latched onto it. And so I've been doing the smoothies for about 2.5 to 3 weeks. And one of the questions I have is, it is 50% kale, 50% spinach, and I'm fine with it. It tastes great. I do banana and all sorts of things, fruits in there. But do I need to mix up the greens, or can I just stick with that because it's great, I like it, but I'm not rotating the greens?
Totally fine. Consistency matters more than variety. I don't go with the whole idea that you need to eat different things every day. First of all, that's not really human, right? Like, we eat whatever. If we were eating what was growing in our neighborhood, it'd be the same thing every day. Two, when you're optimizing nourishment, you're going to get more out of that spinach and kale than you would get out of a buffet of things. So that's totally fine. I mean, I've been eating the same smoothies for a decade. So you find your favorite, you can stick with it, and that's just fine.
Thank you so much for that. And let's go now over to Tracy. I will unmute you. Welcome.
Hi, Tracy.
Hi, thank you. I asked a couple days ago to somebody else about a thyroid nodule. So I was wondering, I'm doing pretty much everything that you're saying. I'm taking like chlorella, spirulina, flaxseed, chia in a smoothie I take to work. I'm doing salads. But have you had any success with shrinking nodules from this kind of
Absolutely.
diet?
Yeah, so it depends on what the nodules are from too, right? Sometimes you can get nodules from hyper or hypothyroid or other things. They usually have to biopsy to find out what they are. But what we want to do, if those nodules are inflammatory, then you're in the right place right now. Just make sure you're also getting iodine. One issue that I have seen that I didn't really have a chance to bring up here is that people are getting more iodine deficiency than before. And it's because I think of the health movement, because iodine was put into sodium a long time ago because everybody ate salt and it's an essential nutrient for your brain and for your thyroid. And so everybody always had enough iodine. Well, now people in the health movement either are told not to eat salt, so they stop altogether, or they switch to like sea salt that doesn't have iodine. And then we're getting more thyroid issues. I figured this out a few years ago. I was like, Eureka, it's the iodine. I was very excited when I figured it out. And so one, if you're getting that high water intake that I recommend, having sodium in your diet is just fine. But if you have a thyroid condition, hypothyroid, making sure you get iodine in your diet is going to be really important. So for the general public, usually about 150 micrograms a day, which is about half to 3/4 of a teaspoon of salt, if it's iodized. Or if you have Hashimotos, they found that 300 was the right amount, but not more, because more or too much is toxic as well. If you've got hyperthyroid, often your doctor will tell you not to use it. So listen to your doctor before me, but just make sure that's not part of the issue, because I've seen that come up more and more, especially in the past, probably 3-4 years, and that can affect thyroid function. So.
Thank you very, very much for that. And let's go now to Christy. I'm going to ask you to unmute. Chris? Let's see if we can get you to unmute. I'm going to ask one more time. Hi, Christy. And
hi, I'm here. Thank you so much, Dr. G. You're my hero.
Thank you.
I have 2 issues I'd like your input on, and I also have a thyroid nodule I forgot about, so that was helpful to hear. High blood pressure and blood cancers. Any experience with blood cancers, specifically CLL leukemia?
Oh, I'm sorry that you're dealing with so much. And I'm glad that you are going to do what I teach. It's really, really important. I actually just started working with a kid yesterday in India who has leukemia, and he's 10 years old. And he was, he was a picky eater. So his parents just let him have like lots of milk and sugar every day, and they didn't know how it affected him. So I just started yesterday, so I don't have a result yet to report. And one thing I have to say about the whole cancer issue is that in the US, doctors are not allowed to say that they are treating cancer if they're not using medicines or surgeries or radiation. So I will not say that this is something that you can use for a treatment. What I can say is that the nutrition will optimize your immune system's ability to fight back. If you remember seeing the pathway I was teaching in terms of the triggers for cancer from the inflammatory foods, as well as that Johns Hopkins that did the study recently that showed cruciferous vegetables blocks replication of cold and COVID viruses. Years ago, did the research that showed that cruciferous vegetables specifically kill cancer cells. So it is still, if you're going to be on a nutrition plan to go along with whatever your medical treatments are, this is the best thing that you can do. And I've worked with people with cancer who did their treatments, whatever they were doing. Some did a lot of treatments, some didn't do them, but who did really well in terms of antibody markers, and even visible tumors. It was really remarkable. So all of these things go together, right? That when you've got high inflammation, you're going to be more likely to trigger genes for autoimmune cancer, all of the things. And some of the treatments for one can cause some of the others. So really all you can do is everything you can do, right? So if you're doing pure hyper-nourishment, that's great. Then work on all the emotional side of being grateful that whatever body you're in is still here. You're winning as long as you're still here, right? That's how I always felt. I was like, all right, I got the diagnoses, but I woke up today and I'm going to make it a really, really good day. So do everything you can to take care of it nutritionally, do whatever you need to medically, and don't forget to just be glad that you're here at the same time. And if you need more help, because if it's complicated, reach out to me and let's figure out a way.
thank you so much for that. And let's go now to Crystal. Hi, Crystal. Hi, Crystal, you there? Oh, Crystal, are you there? We can't hear you.
Crystal.
Oh, no. I am so sorry, Crystal. We're going to move right on now to, let's go to Kim S. Hi, Kim. Welcome.
Hi, thank you so much for everything you do. You're such an amazing person. Okay, so really quickly, my A1C was slightly elevated, so I started following the Mastering Diabetes, kind of Chef AJ, whole food, plant-based, low-fat diet, and it's great. I went from 150 pounds down to 125. Everything's normal, except, so on the plan, I'm doing 15 to 20 grams of fat from nuts and seeds, basically kind of like, the items that you recommend. But about 3 months ago, I started having kind of pain all of a sudden in my hands and swelling, almost like arthritis. And I missed my last 2 periods. So I was wondering, is this just too low of fat for me and I need to up it? Or do you have any advice?
First of all, congratulations.
Thank you.
I can't diagnose the issue for you. I can say I don't do the whole like grams of fat and all that kind of stuff. I focus on the hyper-nourishment side of it. For most people, they can eat nuts and seeds and other things as long as their inflammation is down. But if you're using all of your fats for nuts and seeds and you're not getting your omega-3s, that might be the problem. So make sure you're doing that full hyper-nourishment so that you can get all the healthy fats you need and don't worry about counting your fat number.